I know that you all work in very, very busy departments, and to give up a whole half day to reflect on this together is a big commitment from you, and I really, really appreciate the time that you're putting in.
The Great All Round event was held in response to one of the recommendations made by Robert Francis QC as part of his public inquiry into failings at the Mid Staffordshire Trust, which ran Stafford Hospital. County Durham and Darlington NHS Foundation Trust has been running a series of engagement events between the executive team and trust staff.
I think this has been a really important exercise in, one, listening to everybody, finding out what we're doing well and what we're not, and two, now coming back and responding to that. So I think the key today is beginning to get that feedback to say we were actually listening, and we are making a difference, we are going to make a difference.
I thought it was really helpful. I mean, talking with everybody else, they've all said the same things. They want the staff to be acknowledged, and we want quality for obviously all of the patients, and it's all about communicating between the teams and integration between everybody and the community.
Sometimes in community services you don't feel as though your views as a trust are being met, because we were integrated in 2011, and sometimes you feel as though you're on the sidelines. Today it felt as though we were actually involved in shaping the way the organisation's going.
And really the clinical strategy is based on delivering the highest quality care and disinvesting in harm, which I think is a message that all our staff throughout the Trust can actually understand and appreciate. And I think we all need to look at that and the way we work.
Each member of the executive team presented to the staff.
How was the experience for you as a member of staff? And particularly if we've got within the workforce motivated, connected, people who want to deliver of their best, have a professional desire to do the very, very best, we will deliver a better outcome and better services for our patients.
One of the criticisms of Professor Sir Bruce Keogh was these hospitals were tolerant of mediocrity. So they accepted mediocre practice, mediocre results. We don't want to do that. We want to aim high. And again, picking on Chris's point, when you're looking at the work on your tables today, do aim for what we really want to deliver.
One of the important things that came out of the Francis Review and the learning from its staffs was the fact that they had prioritised, if you like, financial targets over and above service delivery. And so one of the checks that are now in the system is that all of our cost reduction targets have to go through a quality impact assessment.
We invested £9.6 million in the estate to change the likes of accident and emergency services, ITU, and some of the wards within both of the main hospitals.
So behind all of that is quite clear that our core business is unscheduled care, and therefore thinking about our clinical strategy, what we want to do is place unscheduled care right at the front of that and say this is the most important thing to each and every one of us.
Following each presentation, staff were able to take part in smaller roundtable discussions to air some of their own views.
For me, development around older people and working with the REACT teams and working with all what's in the community, to me would be a priority.
But I think it's about making the patient aware from that first visit that you know, this is your named nurse, this is who potentially will come and visit. If you phone through these hours, you know, and just making them aware of exactly what the service is.
So what I'm trying to tease out through this process is how do we get everybody working to uniformly high standards consistently.
Following the presentations and discussions, staff were given the opportunity to vote on what they feel should be the Trust priorities moving forward.
And by quite a long way, although I suspect some people had spent their pennies, 24/7 services are what we've prioritised. So this is 7-day services. And
that was just one of many ideas put forward during the day's event.
A lot of people sit in the offices or on wards saying, nobody ever listens to me. Well, come and speak up, because they were very keen to listen to you and have your ideas.
I would encourage them to come along and see what they can contribute and put their points of view.
Yeah, absolutely. And then you have a voice in the organisation that you work for.
The Trust is us, and I think we need to guide it together and take it to a much better place together.